Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, June the 7th, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, good afternoon and thank you, Brad. May I begin by expressing my condolences to the families and friends of the 4 people, 3 adults and a teenager, killed in London, Ontario yesterday. I know London is a tight-knit community. I've spent lots of time there over the years, and this tragedy will be devastating, as it would be in any community. And I hope that that community will have the answers to what happened and why very soon. But in the meantime, we stand in solidarity with our fellow Ontario residents in London, Ontario, grieving this tragedy. I met earlier this afternoon with the mayors and chairs from the Greater Toronto and Hamilton area. We were unanimous in welcoming both the move to Step 1 of reopening this Friday, announced by Premier Ford and the provincial government, and the improved health and vaccination numbers which gave rise to that decision. Hopefully, the long, hard fight we had to go through to get to Step 1 will remind us that this is only Step 1, and that continued caution, compliance with public health guidelines, and even more vaccinations will keep us moving forward. The mayors and chairs especially welcome the advance notice that has been given to assist businesses and people to get ready for the first stage of reopening. Here in Toronto, more than 2.3 million COVID-19 vaccine doses have now been administered by Team Toronto. We're working to make sure everyone has access to a first dose and gets that dose as soon as possible, and to make sure that everyone gets their second dose as soon as possible. I'm so proud to see the strong uptake we are seeing when it comes to different age groups, vaccinations in fact in all age groups. Getting vaccinated will help to bring this pandemic to an end and ensure that we can get back to all the things we treasure in our lives. So please get vaccinated. Get your first dose and get your second dose, and make sure your family and your friends do it too. If you need more information, you can use our VaxTO COVID-19 text line by texting the word vaccine to 1-833-750-0888. On the weekend, I heard from many people about second doses and their need for more information. We know from Dr. de Villa that 700,000 people in our city alone are now eligible, as of 8 o'clock this morning, to book their second dose. Anyone 70 and older who had already received their first dose can now book their second dose. Anyone of any age who received their first dose before April 18th can now book their second dose. We want all of those eligible people to get their second dose booked and to get that in their arm, the second dose, as soon as possible. The province has set the week of July 19th as the date when people who got their first dose the week of April 19th to May 9th can book their second dose, but they've been clear that that date may come earlier based on supply. I join with my colleagues once again, the mayors and chairs from across the GTHA, in encouraging the federal and provincial governments to consider once again allocating additional vaccines to hotspot areas in the province, including the GTHA, so as to allow us to better contain the Delta variant. Full vaccination, namely 2 doses, is more effective in containing the Delta variant, which poses more of a risk in these hotspot areas. We have made such progress in getting people their first doses in our hottest hotspots and across the city, thanks to additional supplies of vaccine that were made available to us. Now, we need to make sure that we can get the second doses into arms as quickly as possible, and it will require similar consideration when it comes to the allocation of vaccines to hotspot areas. As vaccine levels help us get to stage 1, it also allows for summer camps. City staff have been working to make sure that we, as a city, can offer safe summer day camp programs this year. I'm very pleased and very proud to announce that registration will open for Summer Camp TO starting tomorrow, June 8th at 8 a.m. Summer Camp TO programming will be offered across Toronto beginning on July 5th, running through until August 27th. The city will be offering traditional day camp experiences, including dance, drama, music, arts and crafts, and active games for children between the ages of 4 and 12 at approximately 160 locations across the city. Adapted and inclusive programs for participants with differing abilities will also be available. New this year, the city will be offering Camp TO Plus, in-person specialty camps at community centers and museums, which will be offering specialized programs in French, immersion, arts, creative writing, nature, and science. I'm really pleased that in addition to these new specialty Camp TO programs, we've been able to expand Camp TO for campers aged 4 and 5 this year. We want to ensure that, especially after the experience many of them have been through over the past year or so, Toronto children can have a safe and fun camp experience while making new friends and happy memories this summer. All summer Camp TO programs will follow provincial health guidelines for day camps, thanks to the work of our public health staff as well as parks and recreation staff. They've worked very hard to make sure these camps can be safe in all respects. These guidelines include, on the health side, physical distancing, daily health screening, wearing masks, cohorting, and enhanced facility cleaning. Each camp group will stay together for the entire week and will not interact with other camper groups. Caregivers will receive a phone call prior to camp start to review procedures and to do a pre-camp health check. Camp TO campers and staff are expected to wear cloth face coverings or masks both indoors and out. Camp TO Virtual will also be available. These 45-minute long live and interactive workshops will be available to campers age 4 to 12 with interactive games and creative programming. Programs will also be available for people living with differing abilities with virtual adapted camp options. In total, this summer, the city will offer more than 35,000 spaces for Camp TO, including adapted programs, virtual workshops, and Camp TO Plus. And the other great news in all of this is that more than 1,000 people will be employed to support Summer Camp TO. This includes returning staff and newly recruited young people hired earlier this year as part of our summer job recruitment efforts. The quickest and easiest way to register for Summer Camp TO and Camp TO Virtual is online at efun.toronto.ca. Phone registration will also be available at 416-396-7378, and 5 community center locations will be open tomorrow for in-person registration support. Locations and hours are available at toronto.ca/CampTO. I'm also excited to announce the launch of Park Fit TO, a new pilot initiative offering residents outdoor fitness programming. The city remains committed to finding ways for Torontonians to stay outside, to be outside, to socialize, and to enjoy our parks this summer. Our parks were built for all residents of the City of Toronto to enjoy. The City of Toronto will offer outdoor drop-in fitness workouts, as well as weekly outdoor group fitness and walking programs. In order to facilitate drop-in workouts, a number of the city's recreation centers will move fitness center and weight room equipment outdoors to parks and spaces adjacent to those community centers. Park Fit TO will operate starting this weekend through until September and will follow public health guidelines to ensure the safe, healthy participation of those who sign up. The city is providing both free and affordable paid options for individual and instructional group fitness with registration starting tomorrow. More information about Park Fit TO is available at www.toronto.ca/parkfittto. We are also working to help gyms. In recognition of the increased need for exercise and to assist businesses so impacted by COVID-19 to date, commercial permits for private businesses who want to offer outdoor fitness, yoga, or martial arts classes in park spaces will be available free of charge this summer. The permits will be available free of charge. I will be bringing a motion to the City Council this week to waive the permit fees from now until October 3rd. And this gives both the people who want to take part in these classes as well as the businesses who have been so hard hit these past number of months a chance to do it without the financial burden of having to get a permit from the city or pay for a permit from the city. The permits that they will get, permit holders will be required to comply with current provincial restrictions, including gathering limits and restrictions around amplified sound. We are waiving these fees to encourage people to get these permits so we can manage the space so they can confidently plan outdoor classes and to be of some assistance to these businesses. City crews are also working to open all water fountains in the parks. We have more than 700 water fountains in the city, and ones not attached to public washrooms have been closed throughout the pandemic based on public health advice. Toronto Public Health has now advised our parks officials that they can proceed to open fountains with a risk mitigation approach that includes signage nearby those water fountains. I want to thank city staff for working together to find a way to open these fountains. We are working to make sure that it's a great summer for Torontonians, for all people, for kids and for kids of all ages, as they would say, right across the city. I want to thank our very hardworking city staff. They've had to, in many cases, turn themselves around on a dime to get things done quickly, to adapt to changing restrictions at all different levels, and to make sure that they use their imagination, their innovation, their hard work together with public health to design safe programs so that we are safe in every respect, but of course including in particular public health, given the events of the last number of months. These are programs that I believe will make a real difference in people's lives as we all work to bring the pandemic to an end. It's now time for Dr. de Villa's report for today.
Thank you, Mayor Tory, and good afternoon. Today, I'm reporting 3 days of data, so 394 new cases of COVID-19. That's a daily average of 131 new cases. 713 people are in hospital, 211 people are in the ICU. And I'm saddened to report 15 deaths today. June is a week old, and I've reported to you a total of 42 lives lost. While our own prospects are brighter, this is a reminder that COVID-19 is still something to be taken seriously, and how getting vaccinated is our best protection from it. As of this morning, more access than ever is open to people seeking to book their second vaccination. It could not come at a more important time. All indicators have changed significantly since the peak of this wave. It is good news for all of us that access to second dose booking has expanded as of this morning, so that people can complete their vaccinations and be fully protected. As the Chief will tell you in his upcoming remarks, we understand that already we are seeing a brisk response to the increased access in terms of people trying to book. Overall, getting vaccinated has never been more important, and we have more options than we've ever had in this extraordinary vaccination campaign. This is important because for most of the pandemic, I've tried to persuade you that to prevent the spread of COVID-19, we needed to keep apart as much as possible. Now, we are in a position where we have to come together around the common need to be vaccinated. Overall, there is an impressive performance by Toronto. More than 70% of people 18 and older have had a first dose. In the ages between 60 and 79, vaccination rates for the first doses are approaching 80%. That's what we want to see, and I would like to see this number increase as much as possible. We need to get the first dose delivery further ahead and work hard to complete the all-important second doses during the summer, especially in hotspots, those areas of the city that have been hit hardest by COVID-19 and continue to experience higher levels of disease activity. The booking process may at times require patience with so many people trying to schedule their vaccinations at the same time. I can assure you, everybody involved in delivering those vaccinations wants to get it done for you as much as you want to have it settled. Making this even more important is today's announcement that as of this Friday, the province will move into Step 1 on its roadmap to reopening. A huge number of people in Toronto have shown resounding commitment and motivation to getting us to where we want to be. And so long as that continues, we are on the right path out of the pandemic. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa, and good afternoon. With more than 2.3 million doses of COVID-19 vaccine administered thus far in Toronto, more than 70% of adults over the age of 18 have received their first dose of vaccine. Between 8 o'clock this morning and 1 o'clock this afternoon, 55,992 appointments have been successfully booked in city-operated clinics. Thank you to everyone who has and continues to support this important effort, and to everyone who has made the effort to get their vaccine. Everyone who is 12 years of age or older is eligible to be vaccinated against COVID-19. Also, as of 8 o'clock this morning, anyone 70 years of age or older, along with anyone who received their first dose of either the Pfizer or Moderna vaccine on or before April 18th, are now eligible to receive their second dose of vaccine. As a reminder, we administer the Pfizer vaccine in all 9 city-operated vaccine clinics. Anyone in either of these groups who wishes to take advantage of the accelerated second dose eligibility can do so by accessing the provincial booking system via toronto.ca/COVID-19. The provincial booking system has been updated with a clear and intuitive process for booking an earlier second dose of vaccine online. If you prefer to either book, accelerate, or reschedule your appointment by phone, you can do so by calling the Provincial Call Centre at 1-833-943-3900. I am pleased that we were able to open more than 10,000 additional appointments in city-operated clinics for this week, which have been booked up very quickly. As of this morning, there were only 100 appointments available in city-operated vaccine clinics for the remainder of this week. Based on current vaccine allocations, our clinics are also nearly fully booked for the week of June 14th, although there are still appointments available for the weeks of June 21 and June 28. Between today and July the 4th, based on current vaccine allocations, and as of early this afternoon, there are approximately 14,000 appointments available in city-operated vaccine clinics. If you received a first dose of the AstraZeneca COVID-19 vaccine, you can choose to either receive a second dose of the AstraZeneca vaccine, or you can choose to receive a Pfizer or Moderna vaccine for your second dose. You will be eligible to receive your second dose at the recommended 12-week interval. If you would like a second dose of AstraZeneca, you can book your appointment by contacting the pharmacy or primary care provider where you received your first dose. If you wish to receive a Pfizer or Moderna vaccine as your second dose, you can schedule your second dose appointment at a participating pharmacy, or as of this morning, you can also book your second dose through the provincial booking system. All of these options are safe, provide strong protection against COVID-19, and will count as a completed series, meaning that you will be fully vaccinated. I continue to encourage everyone who is 12 years of age and older and who has not yet received their first dose of COVID-19 vaccine to book your appointment to receive your first dose of vaccine as very soon as you are able. For vaccine opportunities outside the network of city-operated clinics, please go to vaccineto.ca for vaccine opportunities that may exist in Team Toronto partner clinics. For those active on social media, I continue to encourage you to follow Vaccine Hunter Vaccine Hunters Canada on Twitter for additional information on opportunities to receive COVID-19 vaccine in Toronto. Please ensure that you cancel your appointment via the provincial booking system or the provincial call center in the event that you will not be attending your previously scheduled appointment. Thank you for all that you do to help stop the spread of COVID-19 in our city, and please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on vaccination in Toronto. Thank you.
Thank you, Chief Pegg. We'll now go to questions. Just a reminder to please unmute yourself, and we'll go first to Jeff Gray from the Globe and Mail. Go ahead, Jeff.
Oh, hi, everybody. Thanks. I wanted to ask the mayor a question just about the second doses in hotspots issue. There's been lots of talk about it. The province initially said we don't need to do that, and then last week the Minister of Health said that they were thinking about it or looking at it. Have you had any discussions with the Premier directly about the need to do this?
I've had no recent discussions with the Premier about this, but I would only say, and I think the reason that my colleagues, all the mayors and chairs from the GTHA, believe strongly this is something the province should be not just looking at but acting upon is because it worked the first time to help us to really get to the place where we can have this first stage of reopening, and it'll work again in the context of this Delta variant that is posing its biggest risk probably in areas where obviously we're going to see more possibility of infection. And so I think it's just a sensible thing to do for the entire province to take the places that are most at risk of the Delta variant when we're trying to keep the entire province on the path to reopening and on the path to good health, and to allocate vaccine accordingly, knowing that there's a need for vaccines everywhere, but there's a particular acute need in areas not confined to the GTHA, but including the GTHA, where obviously we've had some real hotspots over time.
And to follow up, I guess, do you plan to bring it up with the Premier? And is it frustrating that, again, as you say, they did it the first time. There seems to be a consensus about the need to do it again, and it's taking, they're taking their time making the decision.
I will just say that I know that there are discussions taking place at their scientific tables about this, and I'm confident, just based on what I've heard from our own experts, that they will reach the same conclusion. There's been enough said about this to make me confident that this is the right thing to do. It is the right thing to do for the whole province to stem the growth in the Delta variant, and to keep people healthy and to help those most at risk. And so I think it's just the right thing to do. So I'm not impatient about it, but the sooner we start to do those kinds of things to ramp up our efforts in those communities, and to do what we did successfully once before with an increased supply, I think the better the results will be in terms of keeping us on the right path to ending the pandemic.
Thank you. We'll go next to David Ryder from the Toronto Star. Go ahead, Dave.
Hi there. Question, I think, for both Mayor Tory and Dr. de Villa is that in the past, we've kind of gone through this before where the province says we're ready to reopen. You guys have said we support it. And then later on, experts have said one of the reasons we keep having wave after wave is that we reopen too quickly. So I'm just wondering what this time is guaranteeing to you that, in fact, we are ready to reopen and that this is not going to hasten more cases and possibly a fourth wave.
So, David, thanks for the question. I think what we can say here is that the province has put out a detailed plan for reopening that has a very methodical approach, and it takes into consideration a number of important factors. First, it takes into consideration vaccination coverage, which is something different this time around, and it's a significant difference relative to our previous experiences. I think the other thing that's really important here as well is that it emphasizes the reopening plan emphasizes the use of outdoor spaces first, which is in keeping with the science around what are lower risk opportunities for people to increase interaction and to restore some of those activities that we've been missing so much for a very long period of time, but still does so in a way that's as safe as is possible. And I think finally, my observation is that the people of Toronto and arguably the rest of the province have had the opportunity to really understand, what behaviors, what self-protective measures they can take to help reduce the risk of ongoing transmission while we continue with vaccination efforts, which of course we can't emphasize enough as an important part of the reopening plan. So I think when I look at all of these things together, and hopefully we'll have that opportunity to continue to monitor as we approach step one and move into step one. We can take the time, observe, make sure that those mitigating features that I've just described are actually having the desired impact in terms of reducing ongoing transmission before proceeding to the next step. I think following that very methodical approach is a good thing, and something that we're going to continue to speak to our provincial partners with over the weeks to come. I don't know whether the Mayor has anything further to add to that.
Only to say that that answer that you just heard from Dr. de Villa is these are thoughts and areas of expertise that were shared with the province in the development of their plan, and they were, I think, quite good about consulting and having a plan that is, as described by Dr. de Villa, something that is concise, it's straightforward, it has very definite time periods on it, and so on. And I think that gives us a much greater chance, together with the advent of vaccines and together with, you know, what has been pretty good compliance by people in recent times, a chance to be able to stick to the plan. And I think that's what's important at this stage, is that we now all stick to the plan. It's not just the province sticking to the plan. It's not just Toronto sticking to the plan. It's everybody sticking to the plan, all 15 million of us, but I'll start with the 3 million people that live right here. And, you know, there are good signs in that regard, because I think people very much want to see us reopen and allow them to get back to as normal a life as possible, knowing that we're not through this yet.
Thank you. My follow-up is, I think, just for Mayor Tory, unless somebody else on the line wants anything to add, which is there was a lot of anger over the weekend about people going to park facilities and finding that washrooms that were supposed to be open appeared to be closed. Parents with kids not able to take their kids in. Water fountains closed when they'd be open, say at Ontario Place, but not in the city. Was there a major kind of screw up? Like, why was there so much? Why were there so many services people expected to be open that weren't?
Monday morning staff meetings are sometimes, you know, feature me asking questions about things that I either saw or heard over the course of the weekend. And I asked this morning about the washrooms, and I was told that the washrooms were open, except for those that are required to be closed because they're broken down or otherwise in the midst of having repairs. Now, one thing that does happen is that the washrooms do close at dusk. Needless to say, it's not possible to have a person closing those washrooms, every single one, at the moment of sunset. So there are people that are on a shift, so some will close slightly earlier than that, some will close slightly later. But the bottom line is that I was told this morning that the washrooms were open, except for those that were in a state of getting repaired. I will also say, with respect to the water fountains, I dealt with that in my remarks. The water fountains were closed or not operating, subject to some public health guidelines that were in place that were thought to be wise in the context of a pandemic. We're just now hearing the announcement that we're ready in 5 days to move to stage one. And so it's not as if this thing's been over for weeks. And whatever is going on at Ontario Place is interesting, but our public health officials have the responsibility to give us advice on when they think it is safe for these things to be open. They've now given us that advice, and the water fountains will be open. And I'm sorry, because it was a very hot day on the weekend, that people didn't have access to those water fountains, but I think it's much more important when they have access to them. It is safe, and there will be signage put up now to make sure it remains safe even when they're open. But I think we're doing our very best to make sure we maintain that balance between the convenience that people expect from a wide variety of city facilities and services and public health, which we don't want to slide backwards. We want to make sure we keep moving forward.
Okay, thank you, Mayor Tory. We'll go next to Jane Stevenson from the Toronto Sun. Go ahead, Jane.
Hi, Dave just asked the question about water fountains, so I'll proceed to my next question for Dr. de Villa, if I may, about the Delta variant. Doctor, can you talk a little bit about your concerns with that specific variant, and are you confident in the efficacy of the three vaccines we've been talking about today in fighting against that variant?
So thanks, Jane. Certainly the Delta variant has been the subject of much discussion, as you can imagine, in public health circles all around the world. Certainly we're hearing quite a bit from the United Kingdom. They're a little bit ahead in terms of their experience with the Delta variant, but you've also heard about Delta variant here more locally in and around the GTHA in particular. So certainly there is some reason for concern. We are hearing from our colleagues in the United Kingdom that this variant is more transmissible, anywhere from 40–50%-ish more transmissible than the variant that created the third wave here. So certainly that gives rise to concern, but we are hearing as well that there is some, evidence to support the effectiveness of vaccines, the vaccines that we're using now, particularly as people become more and more fully vaccinated against COVID-19. Hence, you're going to continue to see us, and I would imagine our colleagues all around the province and indeed around the country, really focused on making sure that we're getting vaccines out as quickly as possible, both the combination of first doses where those need to be delivered, and as well as quickly as possible and in the appropriate time frame, those second doses. And as I mentioned in my remarks, of course, we want to make sure that we're providing those vaccines especially to hotspot areas, just given that they've had more activity and have been more significantly impacted by COVID-19.
Thank you.
Okay, Jane, thanks so much. We'll go next to Derek Dio-Narain from the CBC. Derek, go ahead.
Thanks so much, Brad. This first question is for Dr. de Villa. What percentage of COVID-19 cases in the city is Toronto Public Health currently contact tracing, and how important is that testing going to be as we reopen?
So, Derek, I don't know that I can tell you exact numbers right now, but certainly we always endeavor to, conduct our public health activities, whether it's in respect of clusters or outbreaks or individual cases, to the greatest extent possible. Very happy to take a conversation offline to give you very specific figures, but we recognize that as case counts go down, one, we're very pleased to see that, and two, it does actually make it far more achievable for us to engage in very fulsome case and contact management from a public health perspective.
Thanks. And just to follow up, this question is for Mayor Tory. Obviously, there were reports of several parties and large gatherings over the weekend, Riverdale Park being one of the more notable scenes. Residents are expressing frustration with people, leaving garbage or urinating on their properties. They're just wondering if there's more that the city and perhaps maybe even police can do to prevent this kind of behavior.
The police have a difficult job to do in a wide variety of areas, but the one thing they can't do is, govern human behavior of large groups of people sort of in advance of it happening. The best thing that could happen is if people just decided, and I think, to be truthful, I think the opening of, patios and other places where people can entertain themselves will maybe help relieve some of the pressure. But, people just have to decide they're not going to do something that is inconsiderate of the people who live around the parks or beaches and is, frankly, against current public health guidelines and against the law. It's one of those things where why would it possibly take the police hours to disperse people? I mean, I can maybe get the fact that some people would show up, and sometimes it happens spontaneously as a result of social media, to a party. But then when the police arrive and say, look, this party isn't on because it's too loud and it's too big, given health guidelines and so on, why does it take hours, and why does it take a lot of pushback from people who are being told without the police being unduly aggressive about it? I mean, it's a balancing act that I think they're performing very well, to say to people, you just can't stay here, you have to go. And they're not wading into crowds where it could be unsafe for them to give out hundreds of tickets. I think that could cause something far worse. So in the end, we discuss, because it's their decision in the end, but they inform us of their enforcement plans in advance of every weekend. We discuss those. We try to help them to calibrate those in an appropriate, balanced manner, so that we're not on the one hand having too much policing, and on the other hand we're not having too little. And we do the best we can, and they do the best they can. But people have to help out here. And hopefully these changes happening at the end of the week will assist with that. But otherwise, it's just people that decide they're going to be considerate. They're going to be just polite in the context of not leaving litter around. I mean, who does this? How would you feel if you looked out your window and saw somebody throwing, garbage on your front lawn? Well, this is our collective front lawn of the City of Toronto in the parks. This is our shared space. This is the only space that some people have who live in high-rise buildings and so on. And for people to treat it that way is just profoundly disrespectful and is kind of beyond comprehension. But we're working on it as best we can.
Thank you. Our final question is to Natalie Johnson from CTV News. Natalie, go ahead, please. Just have to unmute yourself, Natalie. There you go.
Hi there. Question for Dr. de Villa. As things slowly begin to reopen and vaccines are much more available, employers are starting to think about public health measures that will come along with employees returning to the office. There seems to be a relative amount of legal consensus that employers can choose to require their employees to be vaccinated, with a few exceptions relating to medical or religious grounds. I'm just wondering, from your medical perspective, do you think that a requirement that employees be vaccinated is a smart public health measure as things begin to return to normal?
So Natalie, I think this is a question that a lot of people are asking, and I think I'm trying to take a page from the mayor's book and not engage in legal discussion, given that, I don't recommend that you take your legal advice from a physician. But I will say this. We are certainly, as a public health community, assessing this very question. You can well imagine that this is a subject of a great deal of interest. And I know that our federal and provincial counterparts are also having active discussion in this regard. For now, from my perspective, what we're doing is doing our very best to encourage people to get vaccinated as the best method by which to protect themselves and everybody else around them. We're actually witnessing the impact of vaccines right now in front of us. That's what's allowing us to proceed forward with reopening and with, starting to get back certain aspects of our lives that we've missed for so long. Hence, I think there are really good reasons for people to go out and get vaccinated as soon as they can, and you're going to continue to see me encourage people to do that.
Okay, thanks very much.
Okay, Natalie, thank you, and thank you all for joining us. That concludes today's briefing. Our next scheduled briefing will be this Wednesday, June the 9th. Stay well.